of medical questions. We've all been hearing about ChatGPT. It can do a lot of things, our homeworks, our assignments. Yes, it can even create slides for you. So today we are going to be discussing with ChatGPT. So I'm going to be typing some medical questions and pharmaceutical questions here for ChatGPT to respond. And over here, hope you can see my screen. And yes, please, before I start, give this video a like. And also, if you are new here, consider subscribing to this channel for more valuable health related content. So the first question is, which which of these water is less contaminated contaminated with microorganisms? With microorganisms. So let me list them. Tap water. For tap water, some tap water are purified, so they contain less microorganisms. Stream water is very prone to microorganisms from what I know, and distilled water ranks highest among the three here. So I would say distilled water is the most free from microorganisms. But let's see what ChatGPT is also going to give us. So behind explain the reason behind explain the reason behind your answer. Oh, let's start this all over again. So which which of which of these water is less contaminated contaminated with microorganisms? I'm sorry, the first one just went away. So I'm going to be listing them. As I said earlier, I know tap water, some are actually purified, others I don't know. I know stream water is the most prone to microorganisms, and I know distilled water is ranked top in purified water and distilled water. So explain the reason behind the answer, behind your answer. Okay, can you all see? Distilled water is the least contaminated with microorganisms. Reason: distillation process. Distilled water is purified by boiling and then condensing the steam into a separate container. This I nailed it here. It actually told us everything that we need to know about distillation water, and I'm going to give it, if not if I'm not biased, I'm going to give it 9 over 10 because it really explained what distilled water. Simply, let's talk about tap water. Tap water treatment. Tap water is treated and disinfected with chlorine or UV light to kill most microorganisms. However, it can still contain trace amount of bacteria, especially if the water is the most contaminated because it is exposed it is exposed to environmental sources of microorganisms, including bacteria, protozoa, and viruses from animal waste, soil, and decaying organic matter. Thus, distilled water is the purest, followed by tap water, while stream water is contaminated with microorganisms. organism. Wow, ChatGPT really explained this to the nitty gritty. Anyone at all can answer or can actually understand this information. So in all, I'm going to give ChatGPT 9/10. So let's move on to the next question I have. So I'm going to ask, um, for my 6 weeks as being in a pharmacy, I learned a lot of drugs and indications. So I know Dorita is a prescription drug. So I'm going to be asking ChatGPT about Dorita. I don't know if you've heard about Dorita, but what I know about Dorita is it's a prescription drug, and you can't just go to a pharmacy and go that you are going to buy Dorita without a prescription form. The pharmacist is not going to give it to you. That's what I know. So Dorita is a prescription drug, and it's normally used for pain, like abdominal pain. So I'm going to ask ChatGPT as a pharmacist in a pharmacy. So a pharmacist, as a pharmacist a pharmacy, in a pharmacy, would you prescribe Dorita to someone without a prescription? Without a prescription form. I wouldn't have prescribed the drug, but let's see what ChatGPT is going to say. No, as a pharmacist, I would not dispense Zyrtec without a prescription. Reasons: Zyrtec contains tramadol and paracetamol. Tramadol is an opioid analgesic that requires strict regulation due to its potential for addiction, abuse, and side effects. I'm not done reading, but I'm impressed. Paracetamol is generally safe but can cause liver toxicity in high doses. Two, prescription only medication. In most countries, tramadol containing medications like Dorita are controlled substances prescription. So this is not only for this any disease. If you think to consider this, please just seek for a doctor's attention. Don't use this video to diagnose yourself of any disease. It's just for an educational purpose. Prescription violates pharmacy regulations and could have legal consequences. I remember one of our lecturers taught us that as a pharmacist, you don't have to give drugs out without a prescription form, especially for those drugs that need prescription. There are certain drugs that you don't need prescription before you buy. But for Dorita, you need a prescription before you can buy it. Because I remember during one of my internship at a pharmacy, a lady came there. She said she's buying Dorita. The way she came with this, she said she's buying Dorita. Then my pharmacist asked her that where is your prescription for? She said her sister is a nurse, and then her sister has given her audacity to come and buy Dorita from the pharmacy. Fine, her sister is a nurse, but then if a drug has been prescribed, we need evidence on a sheet, not just a sheet, but a prescription form before we can give the drug to you. So you can't just come and tell us that your sister said come for Dorita because she's a nurse. So let's continue. Patient safety. Some patients have contraindications, example, history of seizures, respiratory depression, or drug interaction. A doctor must assess the patient's condition and determine the correct dosage before prescribing. If a patient requests Dorita without a prescription, I would advise them to see a doctor for proper evaluation and prescription. Well said, well done. And I'm going to give ChatGPT a 10/10 for this one because it explained everything from head to toe to the nitty gritty such that anyone at all can understand. The next question I'm going to ask ChatGPT is also about drugs. So, which drug, which drug would you prescribe to a patient, to a pregnant woman having a low blood count? And why would she be having a low blood count? What might be some possible reasons? So, first of all, before I tap on the enter button, for someone who has a low blood count, for me, I would have prescribed iron supplements for them because we know that iron supplements help with blood increase of increasing the volume of blood. So I would have prescribed iron supplements for the person. But let's see what Chat GPT is going to prescribe. Drug to prescribe for a woman with low blood counts. I would recommend iron supplement into bracket. Example: ferrous sulfate, ferrous fumarate, or ferrous gluconate. Why? Most pregnant related anemia is due to iron deficiency. As pregnancy increases, iron demand for fetal growth and maternal blood volume. Oh my god, Chat GPT is brilliant, honestly, because all these information just in a second. Isn't this amazing? Folic acid, vitamin B9. Why folic acid? Folic acid is essential for red blood cell production and prevent megaloblastic anemia. I think I've met this word. Yes, no, I don't think. I've actually met this word somewhere before. Yes, anatomy lab first year. I met this word in my anatomy manual. Megaloblastic anemia. I remember. Number three, vitamin B12 supplements. If deficiency is suspected. Why? Because a deficiency in vitamin B12 can lead to pernicious anemia, causing fatigue and neurological symptoms. For combined prenatal supplements, many prenatal vitamins contain iron, folic acid, and B12 to help prevent and treat anemia. Possible reasons for the low blood count in pregnancy. One, increased iron demand because the body needs more iron to support fetal development and increased blood volume. So that's one reason why the blood might be low because the body needs more iron. Two might be poor diet because inadequate intake of iron foods such as red meat, leafy greens, and fortified cereals. Honestly, I must say that ChatGPT gives a lot of information such that even if at the beginning you don't understand, as you read further, you are going to understand. And I must compliment it for that. A doctor should determine the cause of anemia before prescribing treatment. That's very true. Iron supplements are not always the solution, especially in cases of vitamins B12 deficiency or hemoglobinopathies. So honestly, I think I'm going to give ChatGPT 10 over 10 because information that sometimes you might not even have any idea about. So I'm going to give it 10 over 10 for this one. My next question: are viruses resistant to antibiotics? So we all know that antibiotics are used to inhibit microorganisms growth. So let's see if viruses are actually resistant to antibiotics. So are viruses resistant to antibiotics? Yes, viruses are resistant to antibiotics because antibiotics are designed to target bacteria. I like that part. Antibiotics are designed to target bacteria, not viruses. So if there is any infection you're having and you've decided to go and buy an antibiotic, in fact, antibiotics can only be used under prescription in the first place. So you can't even go and buy antibiotics and use on your own without a doctor's prescription. So in the first place, you're not going to even get an antibiotic without prescription. Why are viruses resistant to antibiotics? Because they have different structure and biology. Bacteria are living cells with cell walls, ribosomes, metabolic pathways that antibiotics can target. But viruses are non-living particles that do not have cell wall, ribosomes, or their own metabolism. Instead, rely on a host cell. Come on, I'm now downloading it. So if I talk in the microphone, it will come. Yeah, but I'll close it. So that is it for the viruses. So this one I'm going to give ChatGPT an 8/10 because it gave too much information that I felt like it wasn't actually needed. Yes, so 8/10 for that. So I have with me Isabella. Yes, so she's also going to be asking ChatGPT certain questions and we will get to know its responses. So Isabella.
Hello, good evening. My name is Isabella. And as for me, I have some anatomy questions for ChatGPT. I want to see how transparent it can be and also want to see into how much details ChatGPT can give us. So my first question is, what is anastomosis? Anastomosis is actually a term in like cardiovascular system. Currently, we are doing cardiovascular system. So I want to see how ChatGPT will be able to explain this for me. So we've asked it, what is anastomosis? Okay, it's saying anastomosis is the connection or joining of two tubular structures such as blood vessels, intestines, or hollow organs to allow the flow of fluids between them. Then it has also given us types of anastomosis, vascular anastomosis, the surgical or natural connection between blood vessels. Then they also say intestinal anastomosis, nerve anastomosis, lymphatic anastomosis. And to me, anastomosis is a concept that when it was taught in class, I didn't get it. I didn't understand it. And if I have to be truthful right now, what ChatGPT is saying right now, it's not making me understand it any further. It's a connection or joining between of two tubular structures But like most of the tubular structures in our body are connected, they are joined. And they are saying such as blood vessels. Yes, the blood vessels are joined. We know that the veins is connected to the capillary, connected to the artery or other hollow organs to allow the flow of fluids between them. Yeah, that one we know. So like they are not, I don't know if you guys get what I'm saying. They are not giving us any special explanation that is making me get the concept. And the examples they've given us to like so far, they are fine. The examples are fine. Okay, let me continue reading. They are saying why is anastomosis important, and they are saying it restores blood flow or organ function after injury, disease, or surgery. And they're also saying it helps in healing and circulation by providing alternative pathways for blood or fluid movement used in transplants, bypass surgeries, and digestive system repairs. And they're asking me if I would like to know examples of specific types of anastomosis. I don't even understand the anastomosis for me to get the importance, why it is important. So I like, yeah, ChatGPT answers some questions, but to me, I don't think it's always better, especially when it comes to anatomy, because yeah, it has explained it. But to a lay person, someone who is not reading anatomy, it's supposed to explain for someone who has no anatomical knowledge to be able to understand it. But even me, crowd with anatomy knowledge, I don't know what ChatGPT is talking about. But the types are okay, the importance are okay. So I'll give it 3/10.
3/10. Okay. So from Isabella, 3/10 for ChatGPT. Let's ask another question. Maybe ChatGPT will give us a better answer this time around.
Okay. So my next question, I'm still on the circulatory system because that's the topic that we are treating right now. So I want to know what mesenteric mesenteric arteries are.
What are or what is what
What are
are
mesenteric arteries? So that's for me. I'm actually asking questions that are like kind of complex for me to concept that are complex for me to grasp in the class. Seeing how best they will explain it to me, and if the explanation will give me an understanding, then I can rate it that way. So we've sent it to ChatGPT. It's answering. Let's see what they have for us. I think we have bad network.
response one, response two?
So they gave us two responses, response one and response two. So they are saying the mesenteric arteries are blood vessels that supply blood to the mesentery. What is the mesentery?
Mesentery.
So now it's giving us a leading question. What is the mesentery? Ask it. What's mesentery? So they are saying the mesentery is a fold of tissue in the abdomen that attaches the intestines to the abdominal wall and holds them in place. Okay, so it's like a tissue that is around, it's on our abdomen. Our abdomen is like beneath our tummy. Yeah, and it attaches the intestine to the abdominal wall and holds them in place. So I think I kind of get it. That's what mesentery is. So now let's go back to the mesenteric arteries. So mesenteric arteries are blood vessels that supply blood to the mesentery, a fold of tissue, okay, that attaches to the intestines of the abdominal wall. They are crucial for delivering oxygen-rich blood to the intestines and other abdominal organs.
Organs.
And they've also given us some types of the mesenteric arteries. The first one is superior mesenteric artery. They've given us the location as branches of the abdominal aorta just below the celiac artery. Okay, I think that's actually correct. From my anatomy lecturer, JT, I think you'll be proud of me right now if you see me. Then the function is they are saying that it supplies blood to most of the small intestine except the duodenum, the ascending colon and the right part of the transverse colon. Then the key branches of the superior mesenteric artery are jejunal arteries, iliac arteries, right colic artery, and middle colic arteries. These are all facts that I can confirm that are very true. They're also saying we have the inferior mesenteric artery. Okay, they're giving us the importance of the mesenteric arteries. They are saying they supply blood. They are arteries that are vital for the proper functioning of the gastrointestinal system here because per the previous explanation, they said it supplies blood to our intestines and our duodenum. So that's part of gastrointestinal system. So I think that point is correct. And they're also talking about mesenteric ischemia. Blockage or narrowing of these arteries can lead to mesenteric ischemia, a condition where blood flow to the intestine is reduced, potentially causing severe damage to the intestines. Would you like more information on how mesenteric arteries can be affected by diseases or conditions? So I think I'm impressed with this one, but the previous one I was not impressed at all. So ChatGPT will get 8/10 for this one.
Oh, that was an increase from 3 to 8 is an increase. So I think ChatGPT actually really impressed you this time around. So let's go. Let's ask about tramadol because it seems some people have been abusing tramadol. So let's ask. Some people have been abusing tramadol. So I'm going to be asking ChatGPT whether tramadol has advantages because the way people have been abusing them, maybe someone somewhere thinks that tramadol does not even have an advantage. So let's ask tramadol, tramadol, tramadol has no advantages. It's only harmful. True or false? True or false? Then I'm going to be asking it to explain. Explain your answer. So yes, let's see what ChatGPT is going to say. False. Okay, so ChatGPT get 2/10 for saying false because it's true. So let's see the explanation. Tramadol has both advantages and disadvantages or potential harms depending on how it is used. Advantages: effective pain relief. This is very true, especially during surgery. When it's done, normally they sometimes prescribe tramadol because of the severe pain. So let's see. Tramadol is a moderate to strong opioid analgesic used to treat moderate to severe pain such as post-surgical pain, chronic pain, and neuropathic pain. So this is very true. This is very true. Dual mechanism of action, less respiratory depression. These are all true. Honestly, I can confirm they are true. But let's see the potential harms of tramadol. Addiction and dependence. Long-term use can lead to physical and physiological dependence. Okay, actually, whatever ChatGPT is saying here is very true, but I feel like some of the words are too big for understanding. Yes, something like long term use of physical and physiological dependence. That's the explanation they give. Someone might not understand the physiological dependence over here. So for this reason, I'm going to be giving ChatGPT 7/10. Yes, because of the big words that they used over here. Let's see another question over here. So I don't know if you've seen augmentin before. Augmentin is a drug at the pharmacy normally prescribed for bacterial infections. And if you look at the components of augmentin, carbonic acid is a lactamase beta inhibitor which prevents bacteria from breaking in the drug. So I'm going to be asking ChatGPT what or why do we add clavonolic acid to arsenic in augmentin? So let's see what why is uh, clavulanic acid added to amoxicillin, amoxicillin. So let's see what ChatGPT is going to to enhance its effectiveness against beta lactamase producing bacteria. Why? Beta lactamase inhibition. Some bacteria produce beta lactamase enzymes that break down amoxicillin, making it ineffective. Clavulanic acid is a beta lactase inhibitor, meaning good. I was about to say, why did ChatGPT just say beta lactamase inhibitor? Because I was expecting ChatGPT to explain beta lactamase, but then it came down further to explain beta lactamase, which is very impressive, meaning it blocks the enzymes allowing amoxicillin, meaning it blocks these enzymes allowing amoxicillin to kill the bacteria. Very impressive. Expands the septum of activity. Amoxicillin alone is ineffective against beta lactamase producing bacteria. When combined with clavulanic acid, it becomes effective against a wider range of bacteria, including Staphylococcus aureus and other E. coli and other bacteria. Prevent antibiotic resistance. Honestly, ChatGPT has given us a lot of information. So it concluded saying clavulanic acid protects amoxicillin, making it more effective against bacterial resistance. It has really explained everything well. And I think I'm going to give it a 10 over 10 because it explained everything. The only fault I was about to get was the beta lactamase, and it really explained it. So I'm going to give GPT a 10 over 10 over here. Okay, so let's see the next question over here. So I'm going to be asking ChatGPT what happens to human beings when they overdose drugs. I don't know if you've, okay, I'm not going to say you, maybe someone, you were supposed to take the drug today at, let's say, 8 p.m., but then you forgot, and you are supposed to take tablets in the morning, two tablets in the afternoon, but you forgot to take the tablets in the morning, but you remembered during the afternoon when you were about to take the afternoon tablet. So you decided to take the morning one as part of the afternoon, making four drugs. That is an overdose because there are time intervals that you're supposed to take the drug. So you're going to ask GPT that what will happen to one or an individual when they overdose a drug. From what I know if you overdose a drug, it's going to be toxic in your body. But let's see what ChatGPT is also going to tell us. So what happens to humans when a drug is overdose? When a drug is overdose, it can lead to toxic effects in the body, which vary vary depending on the type of drug, the dose taken, and the person's overall health. General effects: the CNS, which is the central nervous system, depressants. The person becomes drowsy, confused, and it can even lead to death. Respiratory effects, cardiovascular effects, liver damage, and what to do in case of overdose. Call emergency services. Do not induce vomiting unless directed by, okay, if unconscious, check breathing, administer antidoses, supportive care. Conclusion: drug overdose can be life threatening and requires immediate medical attention. The effects depend on the drug involved, but the best way to prevent overdose is proper medication use and avoiding substance abuse. So, ChatGPT gave us about, I think, one, two, three, four, five, six effects if you overdose a drug, and it gave us five ways or what you should do just in case you overdose a drug. So I'm going to say it gave us massive information aside what I wanted, because I just asked ChatGPT what is going to happen to someone if they overdose a drug, but then it went on to give me further information about what to do just in case an overdose occurs. That's very good, 9 over 10. But bear in mind that this video is just for educational purpose and not to diagnose anyone of any disease over here. So please, if you are enjoying this video, kindly give this video a like, and also consider subscribing to this channel for more valuable health content just like this. So the last question I'm going to ask ChatGPT is, what is will ChatGPT replace? No, let me ask. Do you think ChatGPT will replace doctors in the future? In the future. So yes, I want to know what ChatGPT thinks. Does it think it can replace doctors in the future? As for me, I doubt. I don't think ChatGPT is going to replace doctors any moment from now. But let's see. Okay, that's kind of nice. ChatGPT cannot replace doctors. I like the fact that it's bolding. In fact, 10 over 10 for this. No, ChatGPT cannot replace doctors in the future, but it can assist them in various ways. Why? Because lack of hands-on examination. AI cannot physically examine patients, perform surgeries, or conduct medical procedures. 10 over 10 for point one. On clinical experiences, intuition, and human judgment to diagnose and treat patients, especially in complex or rare cases. Okay, that's relies on data and can sometimes provide incorrect or outdated, making human oversight essential. How ChatGPT and AI can assist doctors. Very, 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 very impressive. Honestly, I didn't know ChatGPT would say no, it can't replace doctors. Wow. And it has really given strong points and reasons why it can't replace doctors, but it can assist doctors. So, how it can assist: medical research and diagnosis, drug discovery and treatment, medical education, administrative tasks. In conclusion, AI, including ChatGPT, is a powerful tool for assisting doctors, but cannot replace human expertise, compassion, and hands on care. The future of medicine will likely involve AI and doctors working together to improve patient care. Very, very good. And I'm going to give AI a 10 over 10 for this, because honestly, AI can't replace doctors, but it can assist doctors in research and other stuff. So, very nice. So, this is the end of our video. If you like this video, please kindly give it a like and also subscribe to this channel. And you can check out some of the videos on this channel. Thank you very much. Have a nice day, and thank you for watching to this point. Bye.